of the conditions that you mention in your paper is Borreliose syndrome, and then you co-authored another paper just specifically on Borreliose syndrome. But my understanding is they don't even use that term anymore.
No, they call it cervicocranial syndrome now, but essentially, the same thing. It's still that syndrome that encompasses all of those symptoms.
Like what?
Such as ringing in the ears, blurry vision, watering of one eye or maybe one nostril, dizziness, vertigo, drop attacks, and so forth. And instead of calling it Borreliose syndrome, it's cervicocranial, but it means the same thing.
And then these symptoms, I guess, are from the autonomic nervous system. So
Right.
How does instability screw up the autonomic nervous system? Like what happens?
Sure. So in our neck, when we've got instability of, let's say, those capsular ligaments and that extra movement of that vertebrae, something too to consider is that so much of our autonomic nervous system actually lies in the front of our neck. And so when you've got that extra motion of these bones, what can happen is you can actually push on those nerve roots or those ganglia, and cause a lot of these autonomic symptoms. Some people might even get a racing heart or kind of feel shortness of breath. There's a whole kind of laundry list of these symptoms, and not every person with Borreliose or cervicocranial syndrome has every one. They might only have a few, but they all come back to that overactivation of that autonomic nervous system from neck instability.
You probably have seen this too, like they even might have incoordination or they have a nummy feeling.
Sure,
They have
yeah.
a nummy feeling. And then the neck is kind of the masquerader of everything. Like there's folks that they could actually have leg symptoms and it's actually coming from the neck, right?
Sure, because every nerve, that's coming through our whole body's got to go through our neck first. So you could have neck instability and degeneration, but maybe it presents more in the legs or maybe in other areas, but it's all coming from up there.
Some people go see an upper cervical chiropractor. And then how would somebody know if they had, say, upper cervical instability? And how are C1 and C2 different than the other cervical vertebrae?
So to answer that last part first, C1 and C2, the first two vertebrae, they control or they allow for 50% of the rotation in our neck, and then all the other cervical vertebrae allow for the other 50%.
So when you say rotation, you're talking about this motion.
Looking over your shoulder. So they actually have a lot more mobility and I guess less stability than the rest of our cervical spine just innately. So when you injure them and they don't have as much ligamentous and bony support as the other vertebrae, that's what can happen. People that see upper cervical chiropractors, that then come to our office, what they tell us is, I don't hold my adjustments.
Oh, okay.
Or, they might see their upper cervical chiropractor and they're putting, C1 back in place, but it's, 3 days later it slips out for whatever reason, and they're just not holding it in the proper place due to that lack of stability.
And then some people get diagnosed with occipital neuralgia or trigeminal neuralgia, and you were saying that that's somehow associated with the upper cervical.
Sure, because you think, if you have really anywhere, kind of along your spine, if you've got extra motion of the vertebrae and there's nerve roots around there and other nerves, any kind of extra motion could kink or press on those nerves and cause a lot of pain, especially, with occipital neuralgia kind of right here at the base of the skull. If you've got C1, C2 instability and those bones are moving more than they should and those muscles around it are tightening, trying to hold everything in place, they could easily tighten around that nerve and cause a lot of pain.